On November 2nd at the PimaOnline Educators Conference, Dr. Imad will address our conference theme, Disrupting the Distance, with a focus on how we chart the future together with care. Mays, when you think about the distance, and that might be the distance between students or the distance between students and teachers, the distance between our educators, or even how to make distance learners feel more connected, what comes to mind?
So I think we have the possibility to transform online distant education to make it, I want to say, learning sanctuaries, virtual learning sanctuaries, to make it places of healing and connecting and even making things that are impossible possible and even likely.
So you're an expert on teaching and learning, and you're also a brain scientist. Can you tell us a little bit about the neuroscience of caring and collaboration, or why it's important that we feel connected as learners or as educators?
So the brain has evolved to connect and make meaning. It's a meaning-making machine. It's really the only organ in the body that we say it's a social organ. And so how you are, how you show up, impacts me and vice versa. That I know that I am part of a community where if I fall or if I need something, there are people that will have my back, that hold my heart. And it's not something that I articulate, but it's implicit, it's subconscious. That's why belonging is so important, meaning making is so important. And all of those things are part of the, if you would, the care, a care ingredient. What does it mean to care? What are the ingredients for care? Does the care for self look different than care for others? How can we, should I say, how can we reimagine care, right? So it is generative and organic and sustainable and healing. Mm-hmm. So I think before I talk about what we know about the neuroscience of care, I would like to, and I'm going to invite the community to interrogate this notion of care. What does care mean? Care for whom? Care for what purpose? Do we extend care for the purpose that's purely transactional, or to transform into something that is that's more sustainable, not just for our local community, but globally?
I know that when the outbreak of COVID came about, it was a profound disruption of life as we know it. And I think by extension, it shifted how we teach and how we learn. And arguably, I think the advent of these new tools, these generative AI tools like ChatGPT, will again see a kind of disruption in our classrooms that are going to be for the worse and for the better. When you think of how we navigate such disruptions, what comes to mind? What to you works and what doesn't work?
I would say with care, navigate with care, navigate with cautions, navigate with curiosity. So I was really on the fence with ChatGPT, and I put a lot of statements in my syllabi about what you can and cannot do. And actually it was you, Reed, that when we had a conversation and you started kind of showing me what is possible, and I got to see your excitement. I mean, I'm still cautious.
As you should be.
I got to see your excitement, but I had a moment where I thought, oh, this could be so empowering for some people to use it, in this way or that way. So then the curiosity became kind of the emotions shifted. I went from fear and even anger to, let me see. to, even some, excitement and some, I suppose, some happiness. Yeah.
Returning to the question of care, I think most education systems seem to be prioritizing what's easiest to measure. Perhaps that's because society at large often prioritizes that, but it's hard to measure, the way care is shown or why care matters. One of the challenges for all educators is that we're not going to see hope or care or growth as a Bloom's verb in a course learning outcome.
Mm,
It's even though they matter, they're
mm.
hard to measure, so we're not going to see them in there. And yet they do matter for the way we approach teaching and learning. They're essential. And why do you think, with neuroscience in mind, why is care so important?
I mean, I'm a scientist, so I am going to always want to measure, want to assess, want to reproduce. So we need to expand our understanding of what it means to measure, to assess, to reassess. I could tell you how we neuroscientifically, how we use brain imaging and EEG data to find correlation between a person's care disposition and their prefrontal cortex or their amygdala health and firing pattern and so on. We could do that. And I'm also interested in sitting with this notion that what if, the most important things in life, what makes us human, that to hope, to care, to sit in the pain, to mourn, to grieve. What if those things are the subtleties of what makes us human? And what if those subtleties are just, we're not yet able to measure them, but still can appreciate them and teach about them and work with them? This is what I'm sitting with. Yeah.
What kinds of difficulties or barriers or obstacles do you think we face as it relates to the distance?
Many, but what is coming to me and what I am feeling is the lack of presence. And it's this multitasking, overwork, sensory overload that is, so I can be doing an online class, distant education, and I'm fully present. And I could learn just as much as if I were sitting in a classroom and connect and feel. So it's not that there's no science that tells us that online or distance we can't learn. No, we're capable of that. It's this, we're being kind of like, again, the sensory, the phone, the sensory overload, this being spread too thin, multitasking. So when we attend to something, whether it's in the classroom or virtually, or multitask, we're not fully present. And that makes engagement very difficult. And that makes the reward that comes with engagement short-circuited. The reward at the I'm talking about the brain level. Yeah.
Absolutely. It's funny, as you spoke, I saw a message from one of our faculty asking about reserving a projector and it just popped up on my second screen here. It's so easy to get pulled away, whether we're in the classroom or whether we're online, because of the devices that we're attached to.
Mm-hmm.
I'm wondering what we as educators can do to help our students be more present, and what we can do as educators to be more present in our classrooms.
I'm going to talk about that. I'm going to share some examples of what I've been doing. And also, I'm going to talk about just paying attention to oneself. I'm finding out that I'm noticing that sometimes I'm talking with someone and I just wander, or they're talking with me and I wander. And I did not have this. I had like really very easy time to focus. Didn't have that before. And now it's like I have to remind myself, almost like a child, okay, pay attention, don't think about dinner tonight, pay attention, don't think. So then have conversations with the students. I mean, I'll share examples of what I do with my students. Yeah.
Wonderful, wonderful. Building upon your research into neuroscience, what do you recommend for faculty or staff or students as we consider practices that help us persist amidst the disruptions and the distance we might feel?
So I think working with meaning and purpose are really important. Again, the brain cares about when the brain is under the influence of strong negative emotions, going to ask questions like, why should I care? Why does this matter? All of this is subconscious. And it's very important. So I think whether with myself or my student, I am, just engaging the practice of reminding myself of my why. Also, it just happened. I wandered. So yeah, I would say, also pausing to make intentional connections. So, and then for inside the classroom as educators, I would say kind of wrestling with this. I have so much content to cover. What if we were to revisit that? And what if we were to kind of work with reducing the content so we could pay attention to and allocate time to work on these other emotional aspects that are so critical, like building relationships. There's a lot of research that says students, actually more just recently, research showing that students expect their professors to help them with their emotional regulations and mental health. And I would say, perhaps, okay, maybe most of us are not trained, but we could learn this. We could learn it. We could, again, allocate the time for it in the class, within our curricula, and so on. Yeah.
Mace, thank you for sharing some words with us. We're really looking forward to seeing you at the upcoming PimaOnline Educator Conference. And just in closing, I would love to ask you to summarize, in a couple sentences, what should educators expect when they come to your keynote?
I'm going to talk about the current moment in higher education and the struggles that students and educators are facing. What are the roots or reasons for those struggles? And then I'm going to talk about what can we do about it. And I'm going to bring in the lens that I know well, the neuroscience. What does the science tell us and how can we leverage that science? And throughout, I'm going to talk about the notion of care and what it means, how it connects to both trauma and healing, and forging a sustainable and a more beautiful higher ed.
We look forward to having you, Mace. Thank you.
Same here. Thank you.